Good evening, and welcome to Future Choices. My name is Fran Snedeker, and I am the moderator and producer of this educational series, Exploring Reproductive Health Issues. We are filmed at the LMC TV studios in Mamaroneck, New York. I suspect that most of you, like me, have had the experience of coping with cancer, seeing your sisters, your mothers, your best friends, when they are faced with the insidious onslaught of cancer. Several years ago, on Future Choices, we learned from Judy Dobroff and members of the cancer support team about valuable services available to families in southern Westchester who have gotten a diagnosis of cancer. The cancer support team does wonderful work. And therefore, when Judy Dobroff alerted me to the fact there's a great new cancer program at Lawrence Hospital, I contacted the program coordinator immediately. Future Choices is very fortunate to have with us today Shirley Stegner, who's the nurse practitioner for the Cancer Survivorship Program at Lawrence Hospital. She's been there since 2008.
That's right.
And having been trained at the University of Tennessee, has nearly 40 years of working with people who have been diagnosed with cancer. Welcome to Future Choices.
Thank you very much, Brian.
And please introduce us to your colleagues who will share their special perceptions about cancer survivorship with us.
Certainly. This is Dr. Carrie Ann Page.
Hello.
She is the medical director for the Cancer Survivorship Program at Lawrence Hospital Center and an internist. And this is Alberta Darko,
Hi.
who is a participant in our Cancer Survivorship Program. She is a cancer survivor and she attends our support groups that we sponsor, and also has worked with me in a one-on-one consultation, which is the primary focus of the survivorship program.
Now, survivorship is a new concept to me. You were introduced the word to me. What is it that we, the audience, need to understand about survivorship and the possibilities it offers to people who have completed their cancer treatment?
Well, I think that is the critical part of it, is that it is for people after treatment. And I know that there's may be a perception, and certainly people who've been treated experience this, that once the treatment is over, well, that's, the hallelujah, and then things are supposed to just go right back to normal. But that's not the way it works. And we do know that after people are treated for cancer, that they may be left with different difficulties, challenges that are related to either the cancer itself or the treatment for the cancer. Sometimes these are physical, sometimes these are emotional, spiritual, social. And so programs are developing to help people address these post-treatment needs. And that's what the Cancer Survivorship Program is focused on at Lawrence.
And what does the cancer survivorship mean to you as somebody who is participating in the program, Alberta?
Cancer survivorship means a lot to me. It came when I really needed something to hold on to. Because after my treatment, especially after my radiation, my last day of radiation, and they told me, we've finished, but you need to see an oncologist. When I went to my doctor, the treatment didn't seem the same. It's like, I'm done. I'm done with you. See, the most of your treatment is complete. And he didn't say it, he didn't show it, but I felt a big void. It's like almost you're on your own. You come see me, but you are sort of almost on your own. So that void is what Cancer Survivorship has provided for me. And it has been extremely, extremely helpful. I can call Ms. Stegner at any time and tell her my problem or question. If she doesn't have an answer readily, she will research and she will get back to me. So this is a program that I need, and I want the world to know that it's really needed. And also, the groups. You go to the groups, you present, and you feel comfortable to really touch your feelings because you are speaking to people who may be feeling the same way that you feel, or even worse. Sometimes I say maybe in the group I draw a lot of strength because there are people who may have had it worse than I have, so maybe I can give them some of my strength. So cancer survivorship, this is some of the qualities that I've found in that program.
And perhaps this is a good time to ask you, Carrie Ann, to give us a quick history of survivorship programs.
Several decades ago, we were mostly focused on treating and defeating cancer with sometimes only limited success. And as detection of cancer has happened at earlier stages with better detection methods and treatments have gotten better, there are more and more people who now are successfully treated for cancer and live free of their cancer for many years after their diagnosis. Currently, there are over 13 million cancer survivors in the United States alone.
Right now?
Yeah,
Wow.
right now. And estimated over 40 million worldwide. What researchers and doctors learn from patients is that after the cancer is gone, there are still lots of other things left. There may be lingering side effects from treatment. There may be late effects from treatment, things that happen after the treatment is over. And that there's risk for other problems both from the cancer itself and from the effects of the treatment that may occur many years after both the treatment and the cancer are over.
Oh, wow.
So that information and recognition of those new findings has spurred a number of medical professionals in concert with patients to really develop the paradigm of cancer survivorship, the group of people who've been successfully treated for cancer, but who haven't really had much services directed toward them. We think about providing a lot of support for people who are initially diagnosed and during their treatment for cancer, and we have a lot of support services for people who may have relapsed or have had advanced cancer or are still undergoing treatment. But those people in the middle who've been treated and who essentially are free of their cancer have little services available to them. So recognizing this, as well as the health implications of this group of people, the Institute of Medicine published a landmark paper in 2005, which really defined the needs of cancer survivorship and the need to think about cancer survivorship as a distinct discipline in medicine and oncology and in medicine in general. There's been a lot of publicity because Lance Armstrong, the Tour de France cyclist champion, himself a cancer survivor, really has been a focus of bringing recognition from the general public to this issue and has provided a lot of funding and support for the development of programs. Along with the National Cancer Institute and other national organizations, has led to the development of cancer survivorship programs, both in academic medical centers and in community medical centers around the country. At Lawrence Hospital Center, we are the first program in Westchester to have a cancer survivorship program, and one of the relatively few community-based cancer survivorship programs in New York.
And that it was started at Lawrence with you, with that in
Well,
08.
there was some groundwork that was laid prior to my coming, and then once I was there, we really started developing the service and trying to get attention to the service so that we would get patients coming
Now,
into the
how
service.
do you make sure that the survivorship element of the program are congruent with the medical protocols that at Lawrence, or I assume that it's not just Lawrence patients who come.
No, it's anybody in southern Westchester is eligible to come. It doesn't matter where they've been treated. We do have many patients who have gotten their treatment in the Bronxville or Mamaroneck or southern Westchester area. We also have people who live in this area but were treated at Memorial, and they come to Memorial Sloan Kettering. They come to the program, and we have people who were treated in neither place, but they still learn about the program and they come to us.